We're in the fight of our lives right now, and our enemy is ruthless.
The number of COVID-19 cases in Ontario continue to rise, and long-term care homes are becoming a breeding ground for the virus. Ontario has 626 long-term care facilities, 114 of which have reported an outbreak of COVID-19. Over half of deaths linked to the virus in Canada were residents of long-term care homes. In a press conference on Tuesday, Premier Doug Ford said despite the province's best efforts, we are dealing with a wildfire in these facilities. An enhanced action plan will be launched tomorrow, which aims to stop the spread in the most vulnerable population.
Our plan will include more support and more resources. We will spare no expense to protect our most vulnerable. We must redeploy every available resources to our long-term care homes right now. It is absolutely critical.
Long-term care home employees will also now only be able to work in one facility during this health crisis. Some care homes in Ottawa implementing this measure over a week ago. But some good news, hospitals are not seeing a surge in COVID-19 patients thanks to ongoing efforts. They still have capacity, which means healthcare workers can now be deployed in long-term care facilities.
My top priority right now is getting the troops and the resources needed to this front. We're going through everything we have at our long-term care homes, and tomorrow we will launch an enhanced action plan to fight COVID-19 in long-term care homes.
Some medications, however, which are needed to keep people on ventilators are in short supply, a concern for healthcare workers. Ontario Health Minister Christine Elliott said the province is working with other countries around the world to ensure they don't run out.
Well, we have been concerned about the supply of a number of drugs available on the market. That is one of the reasons why we put the 30-day prescription refills in, so that there would be medications for everyone. For the specific medications required for patients on ventilators, we're constantly sourcing new drugs. We're looking for the new ingredients for them from other countries. We're working with India in particular right now, and of course we're working with the pharmaceutical companies as well. They are giving us ideas of the supplies that they have, what else they need to have, and we're prepared to go and negotiate with other countries as well to get the active ingredients that we need in order to make these medications.
2 weeks ago, Education Minister Stephen Lecce said students will be returning back to the classroom on May 4th, doing their schoolwork online until then. But the province of Ontario has extended their state of emergency until at least May 12th, meaning that date will be extended again. At this point, it's still unclear when classes may resume. The Premier is saying the school year isn't over yet. 82 inmates in 50 prisons across the country have also tested positive for COVID-19. Corrections Canada is saying they have implemented new safety measures, which include enhancing cleaning in the facilities, suspending visitors, and requesting early sentences where possible. As of Tuesday evening, Ottawa has 619 confirmed cases of COVID-19, with 12 deaths reported. These new measures announced by the provincial government are aimed at helping workers in these long-term care facilities. As of today, there are 16 institutions with outbreaks all across Ottawa. Charlie Cenac, WIN News, Ottawa.